you know, out of the 95 local public health departments, we're one of a few handful that are certified public health departments. And we're certified through a system called CHAP in Washington, D.C. So Julie, tell me a little bit about what does it mean to be certified?
Well, through CHAP accreditations, we are required to meet a lot of standards. And we have indicators that we look at, and we have to provide documentation or interviews, or a reviewer comes and looks at our staff as they're doing the services to make sure that we are meeting those standards. And when you are CHAP accredited and we have home health here, then if we receive that accreditation through CHAP, we don't have to have Medicare come in, because if you're accredited, your standards are higher even than what Medicare deems necessary. So it's very beneficial, and it's a tool to make the public understand that they are getting very high quality services through our department, that we are tested and reviewed and interviewed, and that we have our ducks in order and are able to have staff that are skilled and professional out doing the services that they need.
That's absolutely wonderful. And I know also that you take a lot of pride into our local needs assessment. Every 5 years you do a community needs assessment, and that's kind of how we base our next 5 years of the health of our community, to come up with those points that we're going to change or make corrections in or additions to. So what are some of the things that we're looking at right now in this plan that we're in right now?
That's right, Doug. Every 5 years, we're required through Illinois law to do an IPLAN, which stands for Illinois Plan for Local Assessment of Need. And so we gather a bunch of community people together, and we do a needs assessment, and we do a prioritization process, and we come up with the 3 or 4 health problems that the community sees as really high, problematic, and necessary to address in our area. And so this time, through our IPLAN, we are addressing 4 areas. And the first one everybody hears about is obesity. And we're looking at not only adult obesity, but childhood obesity. And everybody in America knows that we have an epidemic of obesity with children and adults. And so our community wants us to address that. We're also looking at alcohol usage amongst adults and children. And when we say children, you know, we have statistics showing that kids in the area as early as 11 and 12 years old are using alcohol. And we're a very rural area, and so sometimes that becomes the thing that kids want to do in their off activity time. So alcohol is one, and then gateway drug use. Over the years, there's been an increase in kids using inhalants. Those are things that you just have around your house, like any kind of hairspray, the whipping cream cans, any kind of aerosol thing kids can sniff, anything they inhale like that. So that's the other thing. And then the fourth one is depression and isolation of our senior citizens. And we've seen a lot of that lately, particularly in the light of the flood of 2008, when some of the senior citizens in Iroquois County did lose their homes and some of their belongings and were forced to move and became isolated. And of course, that's very depressing. And so we're trying to help the seniors come out of that and get services and a system in place where we can refer people from their medical provider to the services they need at mental health facilities.
That sounds absolutely wonderful. So it sounds like this 5-year plan, it's obviously an ongoing plan. Tell me a little bit about the community people that are part of this plan. Can anyone join in on this?
Absolutely. We really encourage anybody that has an interest in this to come out and join us. We meet once a quarter, and it's usually the third Monday after the end of the first quarter is like January, February, March, then we meet the following Monday, and we do that every quarter. And it's a group of, sometimes we have 15 to 20 people, and they're from all walks of life. We have people that are professionals come that are from like the prevention specialist or school-based people, special ed, but we also have consumers that come, and we really value when a consumer comes on and joins us, because that perspective is something that's very valuable to us, and that's how we make it a community health plan, because it is actually supposed to be the community that comes together and works on this plan.
Sure, and that's what I like most of all. It is basically lay people combined with professionals, and those professionals are from a variety of disciplines, like you said. If you can look at things from a different viewpoint, from a lot of different disciplines, like a doctor would, a lawyer would, a sheriff would, a hospital emergency room nurse would, versus someone who's just, simply paying $1,200 a month for insurance, a consumer, if you will. We all look at things completely differently, and we need to put all those things together in order to come up with those plans to take care of ourselves.
Right, and as professionals, we need to remember, and it keeps us on track when a consumer comes and we start talking professionally and they're like, whoa, 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 we don't understand what that means. So it helps us step back and say, okay, we need to be more user-friendly per se, and make this more understandable to the public so they will jump on board and help us, because it's going to take everybody in the community. The old adage, it takes a village, is really true when it comes to beating these things like the childhood obesity and adult obesity and alcoholism. Back in the old days when we were kids, it was more prevalent for our mom and dad to look at the neighbor kid and talk to the parents about what he had done. Now everybody's kind of, mind your own business, and that's maybe why we've gotten to where we are today. We all need to jump in, and we do need to be looking at the neighbor kid and saying, how can I help him be a more healthy adult and make our society more healthy? And again, it takes us all working together.
It absolutely does, because in order to have the population become healthy, every individual has to step up to the plate. You are responsible for your own health, and that's what we're here to do also. Public health shows you some of those tools that helps you take care of yourself, or have you take care of your loved ones. No matter really what you do, we've got a myriad of programs and services that we can put you in touch with that can help out in those situations.
Right. So thanks, Doug. We encourage you all just to call your health department, and we'd be happy to give you a tour or spend time with you individually if you're just questioning what kind of services we have. And we'd be happy to come out and talk to your club or, Junior Women's Club, Lions Club. We do all of those things. So just give us a call. You can call our Watseka office at 815-432-2483. And just ask to speak to someone about presentations, and somebody will be happy to assist you.
And please stay tuned on our website, www.fiphd.org, as you can pick up many of these podcasts and learn new programs and services that we'll be doing in the future. Thank you.